So I have to thank my neighborhood for that. They threw this block party, and I met Dr. D. Simone, who is the medical director of BVMI there, and he mentioned he works at this great clinic called BVMI, and he told me what the mission is and what they do and kind of work they do, and it got me very excited. I'm a clinical endocrinologist. We treat patients with all hormonal disorders, thyroid disease, diabetes, type 1 diabetes, type 2 diabetes, obesity. I have a private practice. We have 2 offices in Edgewater and Westwood, and we are a new practice, so I am definitely juggling around with balancing managing the practice and working at BVMI and those other things. There is such a need for endocrinologists at BVMI with very high incidence of diabetes and obesity and thyroid disease that now I exclusively just see patients that are needing help from an endocrinologist. It's because most of these patients are working. I think the population-wise, they are a younger patient. So I feel like by giving them the right kind of health care and we are probably impacting their future complication risk and reducing the complications in their future, including heart disease and stroke and those kind of things.
I think what BVMI stands for to help uninsured patients get the care that they need. That is something that is close to us. What ELLKAY does is we make data from various sources available whenever the physicians require the data. And when Grishma told me that, hey, they are thinking of moving their electronic health record system to a new system, I said we'll absolutely be able to help them out. We help them with the game plan of what are the pieces that are going to be required, how it's going to impact the care of the patients. Obviously, when the time came, we were able to help them out. Grishma called me one day and said that, hey, I was looking for this patient's record, couldn't find it. Okay, clicked on the ELLKAY link, and suddenly everything came about. So that's really what drives us.
So the challenge came in when at some point of time we were having difficulty getting insulin for our patients.
The cost of insulin in other countries is significantly lower compared to the United States. And the pharmaceutical companies, with the lack of a better word, playing games, and asking patients to fill out this form, to get this free medicine, and it's not easy for somebody who's working 7 days a week, to go through that exercise, and get. So we said, why don't we create a fund where we can give insulin to patients, because it has a direct impact in saving somebody's life right away.
Any important medication can be provided to our BVMI patients. And we just started an initial ELLKAY medication fund. Primarily, we thought we would use it for insulin, but then now we are expanding it to other medicines also.
We are blessed to be in a position, where we can help other people.
I feel it gives the greatest pleasure to give back to the community we live in, and especially knowing the people firsthand, who are working so hard and not able to afford the same kind of healthcare and the medication that everybody else is getting. We are not only providing them healthcare and preventing complications for them, but I think we are also helping the society. A healthier society would reduce the cost of the healthcare in future and reduce the burden on the healthcare in future. My passion is to connect with my patients and make a difference in their life. So the BVMI gives me that place to be able to do that and do that passionate work that I love doing.